Hey everyone, how you guys doing today? Me, Dr. Orlando Walters. Something that I wanted to talk about today is, um, soreness. And the soreness I'm talking about is the one after being worked on. So, uh, in my field, you have individuals who are hands-on, and then you have individuals who are hands-off. And I tend to go with the hands-on approach, primarily because in my years of experience, um, you have eyes and then you have hands, and it's important that you use all your senses to be able to assess what the issue is. So I'm very hands-on and I'm very communicative. So I ask a lot of questions to figure out what's going on. So anyway, with the hands-on approach, that means you're going to have to manipulate certain things and move certain things around. And it's very important that patients realize and understand that the day after, you might have a little bit of soreness, a little bit of achiness in the area, but it's very important to understand and distinguish the difference between the achiness and the soreness that you had prior in comparison to the pain that you had before. You might notice that you might be a little achy or sore, but you might have more mobility, you might have less nerve pain, you might have more flexibility, and that could be very similar to doing an exercise for the very first time that you've ever done and being sore for a few days afterwards. I mean, you did exercise, you didn't injure yourself, but you notice that a week or two later, you're stronger for it. So a lot of times individuals, they want to get in and be completely fixed without any effort and without any consequences whatsoever. And unfortunately, life just doesn't work that way, and everybody wants to be fixed and everybody wants to put the least amount of effort and everybody wants everything to come through with the snap of a finger. And it's just not realistic, especially when the reason why you're having your pain and discomfort is because you've been messing it up for weeks, months, potentially years before. And do you want me to fix it in a moment's notice without any consequences? There are going to be consequences. So it's very important, again, like I said, to make sure that you realize there might be some soreness after, but more importantly, pay attention to the positives. There are techniques where you'll get positive gains right away, but a day or two later, the same thing you went in for is right back. So was there any progress at all? Same tightness, same restriction, same nerve discomfort, so on and so forth. So again, I say, be realistic in your progress and your goals. And communicate with your therapist or your doctor or whoever it is that's helping you to attain your goals, because communication is very, very important. So with that being said, you have a great rest of your day. Bye-bye.